Let's be real, no one tells you how bizarre the second trimester truly is. 1 minute, you're euphoric, feeling the first flutters of life inside you like butterfly wings against your ribs. The next, you're hunched over a toilet at 3 a.m., cursing the heartburn that feels like a dragon's breath, because you dared to eat a single slice of pizza. This is the trimester of contradictions, where society paints you as a radiant, blissful goddess while your body stages its own quiet rebellion. But here's the unfiltered truth, backed by science, lived by millions, and rarely spoken aloud. Want a happier, healthier family life? Hit subscribe now for science-backed secrets to better love, parenting, and self-care, delivered straight to your heart. Also tell me in comments that from where you are watching my video. Now let's start. That pregnancy glow everyone gushes about? Sure, it exists, thanks to increased blood flow and hormones that plump up your skin. But what they don't show in the ads is the acne that might erupt like a teenage rebellion, the dark line, linea nigra, that appears down your belly like a mysterious map, or the way your once dainty feet swell into something resembling overstuffed sausages. Research from the American Pregnancy Association confirms that nearly 75% of women experience edema in the second trimester, water retention that turns ankles into puffy strangers, elevation, hydration, and refusing to wear anything with a tight waistband become survival tactics. Then there's the grand performance of round ligament pain, sharp, stabbing twinges that strike when you dare to move too quickly. Your uterus, now the size of a papaya, is stretching ligaments like overworked rubber bands, and your body protests every sneeze, laugh, or sudden shift. Science says this is normal, but that doesn't make it less startling. When it feels like someone flicked a switchblade into your hip, warm compresses, slow movements, and a well-placed pillow fortress in bed can help. But sometimes, you just have to pause, wince, and mutter, "Okay, kid, I felt that." And let's talk about the brain fog, dubbed pregnancy brain, like it's some cute quirk. Except there's nothing adorable about walking into a room 5 times and still forgetting why, or staring at your phone, which you're currently holding. A British Journal of Psychiatry study found that memory and cognitive function can dip during pregnancy, likely due to hormonal chaos and sleep disruption. The solution? Lists. So many lists. And a partner who doesn't smirk when you call the TV remote the clicky thing. Here's the thing no one warns you about. The second trimester isn't just physical, it's an emotional obstacle course. One day, you're weeping at a diaper commercial. The next, you're irrationally furious because your partner chewed too loudly. Hormones are the unseen puppeteers, yanking your moods like a yo-yo, but there's more to it than biochemistry. This is when pregnancy stops being abstract. That tiny flutter? It's real. The ultrasound where you see fingers, toes, a nose? Suddenly, this is a person, and with that comes a tidal wave of love, fear, and existential dread. What if I'm not ready? What if something goes wrong? A Journal of Perinatal Education study found that even in low-risk pregnancies, anxiety peaks in the second trimester as the reality of parenthood sets in. It's not just baby blues, it's the weight of becoming someone's entire world. This is where partners can either be lifelines or landmines. A dismissive "you're overreacting" can feel like a knife twist, but a simple "tell me what you need" can be a raft in the storm. Research from the University of Michigan shows that emotional validation from a partner reduces prenatal stress by up to 40%. So, partners, listen. Don't fix. Just be there. And maybe hide the cereal if she's cried over spilled milk twice this week. Speaking of partners, let's shatter the myth that their job is just to nod sympathetically and fetch snacks. This trimester is their trial by fire. A crash course in empathy, patience, and learning that helping isn't waiting to be asked, it's noticing what needs to be done. Example, when she's battling heartburn, don't just hand her the Tums. Research pregnancy-safe remedies, ginger tea, smaller meals, and prep them without fanfare. When she's too tired to cook, don't say "what do you want?" A minefield, say "I'm making pasta and roasted veggies tonight." A Journal of Family Psychology study found that proactive support, anticipating needs, is far more impactful than reactive support waiting to be asked. And let's talk about intimacy. The second trimester can bring a surge in libido for some, thanks, increased blood flow, or a total aversion to touch for others. Partners, this isn't about you. A Sexual Medicine Reviews * study confirms that pregnancy desire fluctuates wildly and pressure only adds stress. Instead, focus on non-sexual closeness, cuddles, back scratches, or just sitting together in silence. Now, onto the folklore masquerading as fact. If you're craving sweets, it's a girl. Savory? Boy. Cute, but false. A University of Pennsylvania study found zero link between cravings and fetal sex. Cravings are more likely tied to nutrient deficiencies or hormonal whims. You're eating for two. Actually, the American College of Obstetricians and Gynecologists says only 300 to 500 extra calories per day are needed. That's a yogurt and a handful of nuts, not a double cheeseburger feast. No coffee, no sushi, no deli meat, live like a monk. Reality? 200 milligrams of caffeine, 1 12-ounce coffee, is safe, and sushi from a reputable place, low-mercury fish, properly frozen, is fine. Listeria risk in deli meat? Heating it kills bacteria. The Journal of the American Medical Association confirms that excessive restriction often causes more stress than benefit. The second trimester isn't just a midpoint, it's a dress rehearsal. The sleepless nights, thanks, leg cramps, the compromises, goodbye, favorite jeans, the way you learn to advocate for yourself at doctor's appointments, it's all training for the big leagues. So, to the person in the second trimester, you're allowed to love the kicks and hate the sciatica. To feel powerful and vulnerable in the same hour. To roll your eyes at myths and still Google them at 2 a.m. And to the partner, your role isn't to make it perfect. It's to say, we're in this together, and mean it, whether that means rubbing swollen feet, debunking old wives' tales, or just holding her hair back when the heartburn wins. Because the second trimester isn't just about growing a baby. It's about growing a mother, a father, a family, one weird, wonderful, and wildly unpredictable day at a time.